Happy Monday, everyone! How was your weekend? Mine was crazy. Got a stiff neck. I've been on my computer 12 hours a day for the past 3 days.
Thanks for watching, and remember, you can find more information on Dr. Morgan's website at
Oops, I'm still on the closing one.
www.judymorgan.com.
Oopsie. Anyway, yeah, for those of you who joined us yesterday on the Inside Scoop with Rodney and Karen, there was so much more we could have covered. I mean, it literally, there's just so much information, but they've great linking their videos that we did last year and some of the ones that they've done on natural flea tick and heartworm prevention. So, but it was fun. I always enjoy hooking up with those guys. It was just a rough weekend for me because one, I got another daycare head cold, yay, which is making me feel a little ugh. But I also, from Thursday night until last night, I was involved in a Jack Canfield Breakthrough to Success event. If you've never done anything with Jack Canfield, he's the Chicken Soup for the Soul guy. Let me just tell you, it will be life-changing for you. It was life-changing for me. But it's pretty intense, 12 hours a day, staring at the computer, really digging deep inside yourself. And so maybe we'll talk about that on another day, or I'll do something with supporters about that. But really kind of an amazing weekend, but just, you know. Anyway, so this week we want to talk about heart disease. It is Heart Disease Week for us here at Naturally Healthy Pets. So we got a lot of stuff to cover this week, and so what we're going to do today is I'm going to talk about the two most common kinds of heart disease in dogs. Tomorrow I am going to cover heart disease in kitty cats, so all you kitty cat folks tune in tomorrow. We might touch on a couple little things with kitty cats today, but tomorrow is going to be cat day. Wednesday we are going to talk about supplements for prevention and treatment of heart disease. Thursday we're going to talk about feeding and diet for heart disease. We filmed a new cooking video for you guys. And somewhere in there, we're also doing a video probably later today that we will post sometime during the week on how to use the buster cage, the oxygen cage for home use. For those of you with particularly smaller animals with either asthma or heart disease, we have a buster cage that we use for Stewie, and we used it for Pookie. It can be life-saving. So, and people, you know, were a little concerned about how to actually set it up and use it on their own at home, and there are a few little tricks that you need to know. And then on Friday I have a special guest who I am not going to announce yet, but I'm really excited. We're going to talk about something really, more out of the box with heart disease. So, all right. So interestingly, everything shows up at the right time. I'm a firm believer that things show up at the right time. So my Journal of the American Veterinary Medical Association magazine that I received, I don't know, a week and a half ago, had this great little pie chart. And I said, oh, I need to use that. So this is from Guelph, Ontario Veterinary College. And one of the doctors there tabulated causes of sudden unexpected death. Animals presented dead at the university from September 15 to September 2019 among cats and dogs. And she did her little pie graph of what the different causes of death were for these animals that had a postmortem and determined what they dropped dead from. And so in dogs, this is probably not a big surprise, but cancer was the number one. 28% of sudden death in dogs is cancer. But second place to that, 24% cardiac disease. 24% cardiac disease is number 2 cause of sudden death in dogs. And in kitty cats, this one really blew me away. 62% of sudden death in cats is cardiac. And we'll talk about that a little more tomorrow, about why cats present with sudden death from heart disease. I had a cat who did that. Got halfway up the steps and fell over dead. So we'll talk about that a little more tomorrow. And for kitty cats, the number 2 is trauma with only 9%. Cancer for kitty cats is only 3%. So they're cats are not small dogs. It's a totally different deal. Number 3 for dogs was respiratory. Number 4 was trauma. 5 gastrointestinal. Then miscellaneous inflammatory. Then undetermined. Possible toxicosis, miscellaneous infections, pancreatitis is only 1%, metabolic 1%. So cancer and cardiac in our dogs, and definitely cardiac in our kitty cats. So really interesting statistics. Okay, so let's talk about heart disease in dogs in general. So first of all, a murmur. We all get freaked out. The veterinarian hears a murmur, or if you listen to your own pet and you're trained with a stethoscope, you hear a murmur and you go, oh my gosh, heart failure. Well, a murmur doesn't necessarily mean that the heart is not pumping effectively. The pump may still be working just fine. The murmur just means there's a leak and there's turbulence in the blood flow. So instead of hearing, the valves opening and closing and you hear lub dub, lub dub, lub dub as the heart muscle pumps. When we have a leak, so the valve opens and it doesn't close all the way, the blood that has been sent from the bottom of the heart up to the top of the heart, where then it goes, some of it leaks backwards. And so think about a waterfall where there's a lot of turbulence in the blood. Could you stop chewing cords? Where there's a lot of turbulence in the blood flow, or in the water, you hear that loud noise of the waterfall, because there's all this turbulence and the water is kind of splashing back and forth. So that's all that a murmur means. It just means that there's some leakage and turbulence in the blood flow. And we grade the murmur anywhere from a 1 to a 6. Now, the grade of the murmur has nothing to do with how weak the heart is. You would think, oh my gosh, grade 6 murmur, heart failure, dying. No, not necessarily the case. So I have had dogs with grade 6 murmurs that have no heart enlargement and don't need any medication. It just means there's more turbulence in the blood flow. So instead of a little leak, maybe they have a bigger leak and it's what we call a washing machine. It's just whoosh, whoosh, whoosh. So, but it doesn't mean that the heart is not pumping. So the heart muscle may still be just fine and squeezing for all it's worth, but the blood is turbulent in there and it's causing that sound that we hear. 2 things that increase the risk of heart disease are dental disease and kidney disease. So those 2 things, a lot of times we find that we have all 3 things going on at the same time. That a pet is diagnosed with heart disease, they also have dental disease, they also have kidney disease. So that's where we are with Stuart at this point. He has really crappy dental disease. I wish I could fix it, but he's stage D failure, and we'll talk about that. So not really a good anesthetic risk, and believe me, I am all about getting the teeth fixed. And now, because of all the medications, his kidneys are showing that they're not quite so happy either. So, it is a balancing act for all this stuff. So, the disease I want to talk about first is degenerative valve disease, because 75% of heart disease in dogs is degenerative valve disease or mitral valve disease. So you might see it as DVD or MVD, because we all like to use our alphabet soup instead of actually saying what we mean. I get emails from people with a whole bunch of alphabet soup, and it's kind of like, oh my god, I don't even, everybody uses different letters, so I don't even always know what the heck they're talking about. I did that to our new veterinarian. I took in the records for my dogs, and I said, well, Stuart has MVD, SM, PSOM, and CM, and they went, what? So I had to explain my alphabet soup. So mitral valve disease is mostly seen in dogs less than 20 pounds or 9 kilograms. This really is a small dog disease. We can see it in larger dogs, particularly very senior older dogs, but it really is mostly a disease of small breeds. It's most common in miniature poodles, cocker spaniels, miniature schnauzers, dachshunds, small terriers, and Cavalier King Charles Spaniels, and that would include the English Toy Spaniel. And over time, with mitral valve disease, it's leaky valves, the heart will enlarge and commonly does progress to heart failure, which is kind of where we are with Mr. Stewart at this point. So what happens is the valves that are between the different chambers, so we've got the mitral valve on the left side, the tricuspid valve on the right side, we've got other valves that we listen to, but the mitral valve, that's why it gets called MVD, mitral valve disease, is usually the first one that's affected. Eventually, usually all of them are. but the valves thicken, and so they it's like they're getting this inflammatory growth on them. They just thicken, and so they can't close correctly. They become thickened and stiffer, and so that allows the blood to leak backwards, causing that turbulence and resulting in the murmur. It can also be called endocardiosis, valvular regurgitation, valvular insufficiency, chronic valve disease, or myxomatous degeneration of the valves. So you see a lot of different names, and when you get that cardiology report, sometimes you look at it and go, I don't know what those words mean. There's just a lot of different terms that different cardiologists use for basically saying the same thing. And the risk for mitral valve disease definitely increases with age. All right, so clinical signs that we want to watch for. So let's say your dog hasn't been to the veterinarian for a year, is kind of due for its checkup, but all of a sudden you're starting to see some things and you're like, what? He's never had a murmur, he's never had heart disease, but what is going on? So clinical signs might be rapid shallow breathing at rest with an increased effort. So when they're just laying there, like they're not doing anything, but they're acting like they just ran a race. Depressed attitude, not interactive. They might be restless. So if they're getting any fluid buildup in their chest and discomfort and inability to really get their breath, they'll be restless. So when the symptoms seem to be worse at night, because we can talk about the Chinese medicine, that's the yin time of night where the fluid tends to accumulate more. So they might be restless. Like they lay down, it's like they can't get comfortable. They get up, they go to the other side of the bed, they lay down again. That's not quite right. They get up, they walk on the other side, they lay down again. And we see this with Stuart sometimes. And then we'll get the coughing and the gagging. It's kind of like they're trying to get something out of their throat. Well, what they're really trying to do is get fluid up out of their lungs. They may have weakness, exercise intolerance. If it's advanced enough, they may actually faint, which is called syncope. They may have decreased appetite and weight loss. We're dealing with that with Stuart. He's pretty bony. And then if they're in complete failure and they're to the point where they're building up fluid, you may notice that all of a sudden they look pregnant. Like they've got this distended belly and it's fluid actually building up in their belly. Because depending on how the heart disease is affecting them, we can have fluid buildup in the lungs or fluid buildup in the abdomen or both. So how are we going to diagnose degenerative valve disease? Well, the first thing is they may or may not be symptomatic, but let's say you go in for that checkup and they hear a murmur. You go, oh, well, crap, he didn't have a murmur last year. So with George, we took him in for his physical and his lab work, and he has a grade 2 murmur, which he did not have a year ago. So I could have gone for chest x-rays to see if there was any heart enlargement, but I know from personal experience, first of all, I have a breed that's very prone to heart problems and mitral valve disease. Second, I know that I will get a lot more information from an echocardiogram, which is an ultrasound of the heart. It'll tell me how the heart's pumping. I can look at how the valves are opening and closing. I can measure some pressures. I can get my pulmonary pressures, that sort of thing. So for me, I opted to go straight to the ultrasound of the heart, the echocardiogram. You don't necessarily need to do that. If your veterinarian is versed at all in heart disease, they could start, if they hear a murmur, they could start with a chest x-ray. And what they want to do is measure the size of the heart on the x-ray, and if it's within normal parameters and the dog is asymptomatic, then they may say, okay, everything looks really good. Why don't we recheck that in 6 months or 12 months? What are you doing? Depending on the age of the dog, their activity level, their breed, that sort of thing. So you may opt for, okay, we're just going to sit tight, we'll come back in 6 months. Or you may opt for, hey, I want to go get the echocardiogram if you can find a cardiologist. And actually, with George, I could not get a cardiology appointment for 6 months. When I called the university, they're now booking for October. So I went with my local veterinarian, and she has an ultrasound person who comes in, so he's not a cardiologist. He did an ultrasound of George's heart and chest, and then he sent it to a cardiologist friend who looked at it and evaluated it and was nice enough to give us his interpretation of it. So sometimes you've got to find a workaround, and that's what I did. I found a workaround to get a clear answer more quickly. So we have different stages of degenerative valve disease, and stage A is actually no murmur, no symptoms, nothing going on at all, They just happen to be a breed prone to mitral valve disease. So all those small dog breeds that I mentioned, they're basically in stage A the day they're born because they are a breed predisposed to developing mitral valve disease. So all those Cavaliers out there, all those English toy spaniels, pretty much Schnauzers, Cockers, Dachshunds, Maltese, they're stage A right off the get-go. So that tells us we should be proactive in how we are feeding and supplementing those dogs who are prone to the disease. So then we go to stage B1 and stage B2. Stage B1 is asymptomatic. No medications would be prescribed at that point, but there is a murmur. Stage B2 would be asymptomatic, a murmur, and some heart changes present. Not anything really significant, but maybe a little bit of enlargement, maybe a little bit of weakness of the heart muscle, but nothing major. That one is the toughest one to decide whether you want to start medications or not. And frankly, if you took your dog diagnosed with B2 to 10 cardiologists, you will probably get 10 different opinions on whether or not they should start medication and which medications to start. And I've been using the same cardiologist up until now. I've been using the same cardiologist for my dogs for over 30 years. And over the years, even his approach to different dogs that I've taken in different stages has changed. Now, certainly we're learning more. Over a 30-year period, we're learning more and we're finding different ways to treat, so I can appreciate that. I actually like some of the protocols we were doing way back at the beginning better than some of the protocols that we start with immediately at this point. But that is an individual variation based on the dog. I can't tell you, as soon as your dog hits B2, there was a point in time where, and this came from the drug company, so they came out with enalapril, Anacard, I think, for dogs. And the recommendation was any dog diagnosed with a heart murmur, whether it was grade 1 to grade 6, didn't matter, any dog diagnosed with a heart murmur should be started on enalapril immediately. That went on for about 10 years in veterinary practice, probably in the 90s, late 90s, early 2000s. And frankly, a lot of those dogs that had a grade 1, 2, or 3 murmur, their murmurs would disappear when they would come back. So, was it beneficial? I don't know. Did it make the murmur go away? Yeah, we were lowering their blood pressure, so you weren't getting as much turbulence because the blood wasn't as high a pressure going through there. So, but there's a lot of debate on that. That is not the standard at this point. It used to be when I would take a dog in that was in B2, the first thing we'd start them on would be spironolactone. Hardly anybody uses spironolactone. I love it. It's a really mild diuretic. So it's going to be up to your cardiologist, your veterinarian, who you're working with, what their protocol is. And if you don't like their recommendation, if you have the option of getting a second opinion from somebody else, I guarantee you'll get a different answer. Don't subject your dog to 10 different opinions. That it's just a lot of stress for them to go through. All right, so stage B2 is a little controversial as far as medication or not. Stage C, at that point, we do have some clinical signs present. We do have heart enlargement that we will see on both x-ray and on echocardiogram. We may have some signs of heart failure, and definitely in stage C, they're going to prescribe medications. I've had a lot of dogs in stage C over the years. In stage C, I've had really good luck stabilizing these guys and holding them in that holding pattern for years and years and years. Pookie was in a stage C holding pattern for probably 6 or 7 years. Charlie wasn't diagnosed until he was 16 and he lived to 19, so stayed there. So, just because your dog has progressed to stage C, it doesn't mean you have to accept that the cardiologist might tell you, oh, he's got 3 to 6 months to live. No, I don't think so. And then we go to stage D, which is heart failure. And the heart is really big. I wish I could show you Stewie's x-ray. I probably have it somewhere. Maybe if I can find it, I'll post it. The heart's huge. It's filling up the entire chest. It's just really big. We have advanced disease. the medications will generally be increased, and they may be refractory to the medications that you've been using. So for instance, Lasix or furosemide is the most common diuretic that is used to get fluid out so that they're not drowning in fluid in their lungs. When they start being refractory to that, as in you're giving the highest doses you can, you might have increased from twice a day to 3 times a day, it's still not working, they're still and getting fluid buildup. So then we switch to other medications. Torsomide is a much stronger diuretic. I've had extremely good luck with it. I find that cardiologists are very, very reluctant to go to Torsomide because it can put them into kidney failure. You have to watch your doses, you have to monitor their lab work, and that's what Stuart's been on it since November of 2020, and at his lab work last month, we're starting to see some kidney changes. But it took over a year for those kidney changes to occur. So, and what we did is we were actually able to back off on his dose a little bit because we saw those kidney changes. So it really is a monitoring and going back and forth. And generally when a dog hits stage D, the cardiologist will tell you that you've got 2 to 3 months left. So Stuart's expiration date was February of 21. We are now in April of 22, and he still plays with the puppy every day. So fingers crossed, and you do everything you can to keep these guys going. And me personally, I'm not a huge fan of accepting the expiration date that's given. I just keep right on rolling. And then there was another article, believe it or not, that came out, mainly because it's heart month, so all these articles on heart disease came out. This is an article called Breed Impacts Mitral Valve Disease in Dogs. It says the clinical signs in dogs vary depending on the breed, which could impact a patient's diagnosis and prognosis. This was a Morris Animal Foundation funded study published by researchers at North Carolina State University Vet School, which is the ones that are 6 months behind. Like, they're experts at this, but they're 6 months behind, so not good. When comparing the medical record data of 69 miniature schnauzers and 65 Yorkshire Terriers diagnosed with the heart disease, researchers noted key differences between the two breeds. Specifically, the study found miniature schnauzers were significantly younger at the time of diagnosis compared to Yorkies. Additionally, while the most common clinical sign noted in schnauzers was episodic collapse, so fainting or syncope, in Yorkies, coughing was the most common sign noted by owners. And I think that because Yorkies are also prone to tracheal collapse, a lot of times things get misdiagnosed or missed. The findings demonstrate while mitral valve disease is common in small breed dogs, veterinarians should consider potential differences between the breeds. We don't have all the answers yet, but I believe our results will ultimately impact how we recognize and treat dogs with it. The study shows some diseases are more complex than previously thought. Gaining a deeper understanding of mitral valve disease will help veterinarians provide optimized personal care for their patients. So, the symptoms are not going to be the same in all dogs, and you need to know your breed, do some research on your breed, the common symptoms associated with it, and make sure that your veterinarian is up to date on what's going on with your breed. And there are some breeds that, as veterinarians, like I have my favorite breed, so clearly I know a lot more, and my favorite breed before Cavaliers and English Toys was Dobermans, so I know a lot about heart disease in these breeds. But when I had an office manager who was very involved with bulldog rescue, I suddenly had to learn a lot about bulldogs. So you may have a breed that your veterinarian is not really familiar with what goes on in that breed genetically with inheritable diseases. So, it's kind of up to you to do some of that research and be able to have a really intelligent conversation with them. Okay, so the second most common breed is dilated cardiomyopathy, also known as DCM. This is almost all a large breed disease. We have seen some weirdnesses in the last few years, which has resulted in the whole DCM diet debate debacle, and it really is a debacle because it's been so skewed, almost politicized. Seems like that's what our world is going to these days. Like, how do we politicize disease? Like, it is or it isn't, whatever. So dilated cardiomyopathy is a primary disease of the heart muscle, whereas the mitral valve disease or degenerative valve disease is the heart valves. This is of the heart muscle. And so the heart muscle becomes very thin and stretched. And it's because it's thin and stretched and weak, it doesn't have the ability to squeeze hard and pump that blood out of there. So instead of going, it goes, not very effective. So genetically predisposed breeds include Irish Wolfhounds, Afghan Hounds, St. Bernards, Dobermans, Great Danes, Boxers, all larger breeds of dogs, and Cocker Spaniels. Like what? They didn't read the book. What? Cocker Spaniels. So the Boxers are a little bit different. Theirs may be carnitine responsive. So we talk about taurine all the time. Boxers actually have a carnitine responsive. That's an amino acid. And in the Cocker Spaniel, theirs may be a taurine responsive disease. And certainly now we're seeing a lot more of this, and actually when I did the research, it's not even up to date. We're seeing a lot more of this in golden retrievers, and theirs seems to be a taurine responsive disease as well. So symptoms of DCM, or dilated cardiomyopathy: sudden death. Sudden death. These dogs just, you don't know they have a problem and they drop dead. And I don't know, I'm not watching the comments coming up, so I don't know if Dennis Becker from All Provide is on here, but his Great Dane, who is very active, they're out hiking all the time, swimming all the time, and his Dane almost drowned. The dog's a very good swimmer, but he went out in the lake and Dennis had to jump in and go get the dog and bring him back. He had no idea that the dog had anything going on at all. And when he got the dog, he was showing some fatigue. When he got him into his veterinarian, he was diagnosed with DCM, dilated cardiomyopathy. So the dog was showing no symptoms. He was active, he was running, he was swimming, until he almost drowned. And that was just because his heart could not keep up. Thankfully, Dennis is right on top of things and has it under control. But so a lot of times these guys are not giving us the symptoms. So they might be a little lethargic, they might be weaker, they might start losing weight, and you think, well, he's getting a little older, like, I don't know, why is he losing weight? They may collapse, and they may be in respiratory distress, like, I can't get air, and that's because they have an arrhythmia, which is the heart is not beating lub-dub, even though it's weak, it's going, bleh. Okay. All right, finish that page. All right, so diagnostics for these guys. Certainly, we can do a chest x-ray. These guys, if they have dilated cardiomyopathy, literally it looks like they swallowed a basketball. There is this big round. We lose that heart shape that we see on an x-ray. We get this basketball in there. So they're pretty easy to diagnose when you see the basketball on there. Certainly an echocardiogram to really see how poorly is that heart muscle functioning. But another thing that we do very commonly with these guys is something called a Halter Monitor. And the Halter Monitor is, so like my mom just got a pacemaker put in, and before that she had this loop recorder. So they actually put it in under the skin, and for 2 weeks it recorded her EKG, and then they run it through the computer and they can look at it. And that's how we actually found out that her heart had stopped 5 times in one night. So that loop recorder was great. Well, the Halter Monitor, since we don't want to put these dogs under anesthesia and do surgery to insert a recorder, the Halter Monitor is basically a little box that and electrodes that we put on them, and then they wear a vest that holds it all in place. And they usually wear them for 2 to 3 days. And then you send in the box or hand in the box, and they run it through the computer and look at it, and they can see what the EKG has looked like over a longer period of time. Because these guys, they tend to have normal sinus rhythm, and then they'll have runs of something abnormal. And that's when we usually get the fainting or the collapsing. But it can come and go. So if you have your dog in the veterinary office and they run an EKG strip that runs for a minute or two, you may just see normal and go, well, I don't see anything, his heart's okay. But then, if you catch it at the right time, you may say, oh my gosh, he's got an arrhythmia that is all over the place. So the Halter Monitor is great because it gives us a longer period of time, and it lets us know those abnormal beats. Are they all coming from the same place, or are they coming from different parts in the heart? Because that more advanced disease, they're going to be all over the place. So focal abnormalities are less disastrous than multifocal abnormalities. So that Halter Monitor can be really helpful. Certainly for workup on these guys. We want to do our x-rays, our echo, CBC, chemistry, urinalysis, and this goes for both diseases, MVD or DCM. Really important, because when the heart is not pumping the blood effectively, it can cause damage to other organs, the kidneys, the liver, and we need to know what's going on. Really important to get a blood pressure on these dogs, and I find that way too few veterinarians in the general practice are doing blood pressures, and really critical. And if they're put on medications, like if they have high blood pressure and they're put on medications to lower the blood pressure, you've got to do follow-up. You need to know, do we have it too high? Do we have it too low? Do we need to adjust the medication? So it's not a one-time deal. And if you have a really nervous dog at the hospital, it can make it really difficult. So it might even be one of those things where you say, look, my dog, as soon as he walks through that door, he freaks out. Can you come out in the parking lot with that blood pressure monitor? Can we do this some way a little bit easier? I did find that for larger breeds of dogs, this is somebody overseas posted this YouTube video. It was really awesome. Using a human wrist blood pressure monitor for home use in bigger dogs, and it's called an Omron Series 7, O-M-R-O-N. Omron Series 7 wrist monitor, and she had it on her Doberman on his front, upper front leg, and she did the blood pressures, and then she had the blood pressures done at the veterinary office and compared them, and it worked really, really well. So if you have a dog who's got an arm that's big enough that you can use a human monitor on, they do work decently. You might have to work with your veterinarian to show you exactly where to place it and that sort of thing, but if you actually go on YouTube and look for the Omron Series 7 wrist monitor for home use in large dogs, you'll probably see the same video that I did. It was pretty cool. Okay. All right, so you might have a breed that is prone to heart disease, whether it's a large breed or a small breed, and you're like, well, how do I know, how do I know when he's going to do this thing? So there are some biomarkers and blood tests that you can do early before they're actually showing symptoms that can kind of, give you a little glimpse into the future. So one of them is a blood test called an NT-proBNP, and it's to evaluate the pressure of the heart based on stretching of the heart muscle. So this is actually released when those muscles are being stretched. So we're starting to get that enlargement of the heart. So, and it's a very specialized test. Like, you have to use a special blood tube, a special kit. It comes from Diagnostics. So it's not that your veterinarian can just pull a regular blood sample and send it in. They have to read the instructions on how to do it. It's a little bit of a pain in the ass. So, it's a little bit pain in the butt. So some veterinarians are not that thrilled about having to jump through the hoops to do it. But a NT-proBNP can be very helpful as a early diagnostic. And then there's another one called a serum cardiac troponin-1, or abbreviated C-TNL, and that's another biomarker of heart disease. So those would be things that you could ask for if you have a breed that is prone and you want to know, are we heading that direction? So other complications that we can see with heart disease in our dogs, tumors in the heart, pulmonary hypertension, systemic hypertension, which is high blood pressure. We can develop protein-losing enteropathy. Stewart is now at that point where they're just losing protein in their bowel. Hard to keep the weight on them, hard to keep his protein levels up, and then secondary to that, we can end up with fluid leaking in the abdomen, which is a problem. Certainly arrhythmias, abnormal heart rhythms, very common, and fainting. We can, when we're in advanced heart failure, we might start seeing that fluid in the abdomen. They might start developing fluid in the chest, which is going to cause rapid respiration, head and neck extended, open mouth breathing, blue tinge to the gums and tongue. We can get pitting edema of the limbs. So basically, think of swollen ankles in people, and then you press your finger in it and it stays dented. That's what that is. And then we also can get something called pericardial effusion, which is leakage of blood into the sac around the heart. I'm not going to go through all the medications. So one of the things that you need to know if you have a dog with heart disease, the most The most important thing for you to be able to do at home is count resting respiratory rate. So that's breath in, out. That's one. There are apps that you can get on your phone for this. You can use a timer and stare at your dog. I was doing Stuart the other day because he seemed like he was breathing a little harder than usual, a little more rapid than usual, so I just used the timer on my phone. I did it for 15 seconds and then multiplied by 4. That gives me what he's doing for 1 minute. You could also just go for 60 seconds and count how many times they're breathing in and out. They used to say anything under 30 was fine. They've kind of raised that to maybe 35. But you need to know what normal is for your dog. So if normal resting respiratory rate for your dog is 12 to 14, and then suddenly they're 32, that's a big difference. And that could signify that maybe a change in medications is needed. So the resting respiratory rate, I think, is the best tool for home use right now for kind of knowing what your dogs are doing. Certainly if they're fainting, having fainting episodes, collapse episodes, you need to get them checked out. Monitoring and keeping their medications at the right level can be a little tricky, but I find that just like with parents of diabetic pets, you get to know your pet so well. Like most of my clients with diabetic pets, they actually could predict what the animal's blood sugar was before I even took it because they just got so good at knowing what their symptoms were when they were too high or too low. And the same with heart disease. Like with Stuart, I will raise and lower his diuretic depending on how he's doing. So the other day when his resting respiratory rate went up, remember I said I lowered his Torsomide because his kidney values had gone up a little. So he was breathing a little harder the other day and he was doing a little more. So I said, you know what? You're going to get a touch higher dose of your Torsomide tonight because you seem to be building up a little bit of fluid, and we just learn how to adjust things based on what's going on. And when Stuart gets in that kind of stress where his resting respiratory rate is up a little bit, he's a little more gaggy, in addition to playing with his medications a little bit. Like you could sometimes give a third dose during the day instead of only doing 2, but make sure you're talking to your veterinarian and cardiologist if you're going to start playing with things. But sometimes I'll just throw him in his oxygen cage for a half an hour and just let him kind of super saturate with oxygen, and then that will kind of revamp his system and get him right back to where we want him to be. So hope this was helpful for you guys. There are a lot of other heart problems that we get with dogs, but these are the 2 most common. So, and clearly that took 40 minutes, so I don't have time to go through everything we could possibly see. So tomorrow we'll talk about kitty cats, and got stuff for you every day this week. Supporters, not sure. Maybe we'll do TCVM of heart disease, herbal treatments. I don't know. I'll figure it out before the end of the week. How's that? Bye, everyone.